Thank you very much, Professor Chara, for the invitation. Dr. Mark Daibo for that excellent presentation. Colleagues, ladies and gentlemen, we are going to do a three-part presentation with my colleagues. I'll give the first overview of our AIDS program in Uganda. And then my colleagues Michael and Rhoda will come in and make presentation on the TASO approaches for service delivery models, and then how we are using evidence to improve programming. As you know, in Uganda is located in East Africa, in the East African part of Africa, within the East African community, neighboring with Kenya and Tanzania and a number of countries there. We have a big population, which is a young population of about 35 million people, with a per capita expenditure on health of $59 US, and the GDP of 696, close to about 700 US. So we are still a middle income country, still a poor country, but experiencing a very big HIV epidemic, which we are estimating at a close to 7.3% currently. We are doing now an update of a population-based survey which will give us data for 2016 to indicate to us where we are with regard to the epidemic. We do have a big magnitude of a number of people infected with HIV. We estimate that at the end of 2015, close to about 1.4 million people were infected and living with HIV in Uganda, which is a significant number. Majority of them are women, and that we are still continuing to experience many new infections. Close to about 83,000 new infections in 2015, although these have been coming down in the last 5 years. The number of new infections has been coming down. Equally, the number of AIDS deaths has also been coming down, but still significantly, as you can see, about 28,000 AIDS-related deaths at the end of 2015. We have been implementing a national response, which is really basically aiming at ensuring that we put in place interventions for HIV prevention and control, both in terms of making sure that we have interventions for prevention, as well as making sure that we provide care and treatment for those who are infected and affected. And to do that, we've been implementing a national strategic plan, as well as a health sector sector development plan, and an HIV investment case, which prioritizes key interventions that we think have maximum impact. Now, these interventions have been implemented using a combination HIV prevention approach and focusing on a range of areas, including interventions for structural interventions, basically some of the things Mark was talking about, the issues around the cultural factors that predispose our populations to HIV infection, as well as a number of gender inequalities that we need to address if we're going to have a cap on this epidemic. So most of those interventions have been taking place to focus on those key drivers of the epidemic in our country. We also have a number of interventions which are in the area of the behavior interventions, looking at aspects of primary prevention, basing on the abstinence, be faithful, and condom promotion models to ensure that you give the people options to be able to, to have approaches that they can use to prevent themselves from infection. We also have a range of biomedical interventions, as you know, and many of these have been prioritized based on our HIV investment case, ensuring that we are able to intervene and provide HIV counseling and testing. We should be able to focus on STI management, provide voluntary medical male circumcision, as well as programs for elimination of mother-to-child transmission and ART. We've been doing all this based on human rights approaches and focusing on our key populations, men who have sex with men, sex workers, both male and female sex workers, as well as other key and priority populations. In our country, we have significant numbers of fishing communities where we have disproportionately high levels of HIV infection. We've been fortunate to have partnerships that we've been working with. A number of partners. The Global Fund has been putting significant resources in Uganda, as well as the US government through PEPFAR, the UN through the WHO, UNAIDS, and other agencies, as well as JICA, which is the German International Corporation, that has been supporting a number of our interventions in the past. We also have significant other bilateral and multilateral partners, including DFID, CIDA, and other partners that are supporting our response. We are aligning our response to the global strategies, including the UNAIDS targets of ending AIDS by 2030. And here we are looking at ensuring that we have 90% of our population living with HIV diagnosed, and those that are diagnosed, that 90% of them are access to treatment, and to make sure that we have viral load suppression among those that are actually accessing treatment. We've been scaling up our treatment programs, and as you can see in this slide, we've been able to put significant numbers of our people on treatment. We're estimating that close to about 58% of our population that are infected with HIV are now accessing treatment. 63% among the children 0 to 15 years are accessing treatment. So amongst the whole other range of interventions, we are prioritizing many of these high impact interventions to ensure that we are able to have epidemic control. As a result of some of these interventions, as you see here in this slide, that we've been having a big dent on the number of new infections. We know that globally, new infections have been coming down across the board. In Uganda, between 2010 and 2015, we have been able to bring the number of new infections down by close to 40%, which was the target that we had set in our national prevention strategy in 2010, which is a good sign that we're beginning to see impact from our interventions. We are also beginning to see significant reductions in the AIDS-related death. Globally, we've seen this decline across the world, in sub-Saharan Africa, as well as in Uganda, significant declines from about 50,000 in 2010 to close to about 28,000 in 2015. So we're beginning to see some dent on not only new infections, but also on AIDS-related death. Michael will come and talk about the HIV programming that our partner from TASO are doing, and some of the interventions that they have been implementing.